This is definitely a bittersweet one for me. I suspect by now everybody has heard that I will be leaving Stanford to start a new role at Weill Cornell Medicine in September. I will be the new dean of Weill Cornell Medicine and the provost for medical affairs at Cornell University. And while I very much look forward to the opportunity in New York City, I have to say that there is a lot that I'm going to miss about being here at Stanford in the Department of Medicine. And there is nothing that I will miss here than all of you. It's been a great 11 years. I have learned so much in this department from all of you, from faculty, from staff, from trainees. This is an incredible place. It's a place that really lives up to all of the missions of academic medicine, to deliver great care, to do innovative research, to educate and to train, and most recently, to think about how do we extend into the community in real meaningful partnerships. It's been a fun 11 years. You've taught me a lot about myself. You've taught me a lot about leadership. I have enjoyed taking care of patients here. I've enjoyed doing research, working, collaborating with many of you, teaching, training, and I've enjoyed beginning to understand the Northern California ecosystem. It's been, as I say, a lot of fun. But I also want you to know and to be reassured that the department is in a great place. If you want to learn more about my new role at Weill Cornell Medicine, you can check out a video that Erlaz Dalger did in an interview with me that's on the department YouTube page. But what's going to go on here? First off, rest assured, you have a great leadership team here on the Department of Medicine. The vice chairs, the associate chairs, the directors of various activities, the division chiefs, the division managers. We have worked hard over the years to really help create a team that's here to serve, a team that's here to push all of us to higher levels of accomplishment, and really helping create an environment where everyone can thrive here. And that's been one of the key goals. How do we make this an inclusive department where all talent can thrive? And I think we're on our journey in a very positive way towards that goal. I also want to take a moment, if you haven't heard, to introduce the interim chair of the Department of Medicine. That will be Dr. Bonnie Maldonado. Bonnie, many of you know because she's a long-standing Stanford faculty member and leader. Most recently, she has been a senior associate dean for faculty development and diversity. But she's held other positions. She, until recently, was the division chief for infectious disease in the Department of Pediatrics. She is a well-funded researcher. She is a very well-considered public health official. She helped all of us daily during the pandemic. You might scratch your head a little bit and say, why is it that a pediatrician has been named the interim chair of medicine? Forget the title. Think about Bonnie not as an internist, not as a pediatrician. Think about Bonnie as a leader. And that's what the department needs right now. You've got plenty of talent in what I will call the content areas of internal medicine. What it needs is leadership. Someone that understands Stanford, someone that has influence in the dean's office, in the CEO suites, somebody that knows the other chairs, somebody that knows the university and how it works. I cannot think of a better person to serve in this interim role than Bonnie, and I wish her nothing but goodwill and good luck. And as I've told her, here's my cell phone number. Call me anytime. This is a department that I hold dearly and I want to help. The search process. What is it? Well, the dean will thoughtfully convene a committee that will interview candidates over the course of this academic year to select a chair who would be appropriate to lead the Department of Medicine in its next part of its journey. The dean has selected Dr. Blumkins and Dr. Bateman from emergency medicine and anesthesia, respectively, to serve as the chairs of that search committee. I think this is important, that the dean has, I think, thoughtfully always chosen other chairs to do a chair search. He wants to try to get at what is the culture of Stanford? What is the culture in the clinical departments? And I think that we as an institution have been served well by this approach. I'd ask you to reach out to colleagues on the search committee. Talk to them. Let them know your views. Send people emails. They are in the midst of stakeholder interviews and the gathering of information around the department. This is a great department with great people, but there's a lot still to do. And I really am excited to look to see what will the next chair do? What will he or she do in taking this department with all its great activities to the next level? In the interim, Bonnie has assured me, and she's assured the leadership, she's here to help. And that means she's here to help all of you. She wants to see programs that are underway continued. She wants to see that initiatives that have been launched are continued. And she wants to be a leadership supporter of everything that we do in this department. I think as many of you have learned over the years that I've been here, at my core, at my nature, and maybe it's because I'm a clinician investigator, I really love to collaborate. And one of the things I hope that when I move east, that you'll look east to Weill Cornell Medicine, and I will look west to Stanford Medicine to think about what are the new areas that we could work on together. What are some areas in research, in science, in education that we might be able to collaborate on that will be best for both of us? I think those opportunities are there, and I look forward to exploring them. So I will say that this is goodbye, but not farewell. I hope that our paths cross again, and I suspect many of them will cross again. I look forward to watching what you do here, and I hope that you'll watch what we do on the East Coast, and please do stay connected. Thank you.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.